I think when you look at the things ProMedica did and continue to do, I mean, yeah, they cut back the concerts, but they're still doing them. You know, they're still doing a lot of community activities, just maybe not to the magnitude they did in the past.
Right.
And I think what happens is as they stabilize, they'll make decisions about where it goes from there.
Former ProMedica CEO Randy Ostra this week on Leading Edge. Ostra led the nonprofit for 25 years and was instrumental in making it more than just a series of hospitals and doctors' offices. In his time, ProMedica invested in not only downtown Toledo's Renaissance, but it also pumped life into businesses and events across the region. Tonight, a discussion with Ostra and the current head of Mercy Health on whether these institutions have a responsibility to heal us, to help us, or to do both.
This is what most people think about when they hear the words healthcare. Doctors, nurses, patients, and the facilities that house them all. But for Northwest Ohio, these also define our understanding of what healthcare does. Concert events, sponsorship of major sporting events, redevelopment projects of once dilapidated buildings, and lights, 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 sometimes to the chagrin of area residents, like in 2012 when more than 50 residents signed a petition to get rid of the Flower Hospital lights. The petition stalled in council.
I think hospitals and doctors and nurses, legitimately wonder whether they're in the healthcare business or they're in the health business.
Wharton School healthcare management professor Dr. David Ash says there are lots of pathways to health. Healthcare is just one of them. The others, he says, are largely social.
Community development, being an employer, providing education, expanding the economy, all of those things are separate pathways toward health, often more important pathways than healthcare. But I know that hospitals vary in the degree to which they actively take responsibility for those other pathways to health.
Randy Ostra often said he spent 30% of his time focused on healthcare and the other 70 doing things to build up the community. He was focused on the social determinants of health, food security, job access, education opportunities. But ProMedica is not the same company it was a few years ago.
Did ProMedica get too big, or was this just we're reacting to the current climate?
Yeah, you could maybe say that. I mean, we were exposed, and again, I think in retrospect, we do these risk assessment in companies. Worldwide pandemic wasn't on a risk assessment.
ProMedica named Arturo Polizzi as its new CEO in November of last year, taking over for Ostra, who announced his retirement the month before. ProMedica made a $23 million profit in the first quarter of this year, but that was coming off a $340 million operating loss in the fourth quarter of 2022. We asked for an interview with Polizzi, and ProMedica's spokesperson told us, quote, "We're not in a position to focus on all of this now, as we are heads down working on positioning the organization for long-term financial stability and success."
They will continue to do the things they can for the community and the social determinants. They just need to pause right now.
While headquartered outside of Toledo, the Mercy Health leadership says there are times it doesn't talk enough about some of the things it's done for the community. While there may not be concerts and sports sponsorships, there are years of investments in the St. V's campus, the new Perrysburg Hospital and Cancer Center, and several satellite branches providing healthcare options.
Yeah, I don't know that there's a bright line as to where that responsibility begins and ends. We frame it up in terms of being good help to our communities and trying to create some priorities out of that.
Baxter's not oblivious to what's happening at ProMedica and the business of healthcare around the country post-pandemic. On the other side of the country, for example, in California, a recent study showed that 52% of the state's roughly 400 hospitals now have negative operating margins, nearly double the 28% seen in 2019.
When the bridge collapses, everybody comes in with heroic efforts to take care of the injured, to rebuild the bridge at great expense. But we don't pay a lot of attention to the study that came out 3 years beforehand that says for a fraction of the dollars we can prevent that bridge from collapsing. That's sort of one of the crises we have in healthcare today.
texter also touts Mercy's commitment to the zip codes around St. V's and the work it's done to improve infant mortality rates. He says in 2018, 12% of infant deaths in Lucas County occurred in those zip codes. But in 2022, that number dropped to 5%. But post-pandemic, does making life better in the 419 rely on future investment by ProMedica and Mercy Health? Toledo Mayor Wade Kapsakavich told WTOL, regardless of their different models, Toledo needs both of them to succeed. They are two of the top 5 employers in our city, so their approaches are working, and we need it to continue. And continue it does. Mercy Health is currently assisting communities surrounding the now closed St. Luke's Hospital during the transition of services, even supplying employment to 400 former St. Luke's workers. And ProMedica is overseeing the transformation of downtown's Jefferson building, making way for a West Coast tech company, Bitwise.
We do want to mention we offered the Toledo Clinic a chance to participate in our story, but they did not return our messages. Dr. Ash from the University of Pennsylvania says if it's not healthcare providing the social determinants of health, it needs to be city government or some other entity picking up the ball. But he warns healthcare faces a more fundamental crisis, and that is how much people actually want to work. He says burnout among doctors and nurses was trending even before the pandemic hit. The fall of ProMedica is easily the most shocking headline locally from this healthcare crisis. In 2022, as you heard, the company lost hundreds of millions of dollars, almost $350 million in that last quarter alone. Coming up tomorrow night at 6, our Tim Miller takes a deep dive into what caused those staggering losses and what could happen next. You'll see big changes from the company this summer, with more to come.